If you often get up at night to go to the bathroom, you are not alone. This is a fairly common disorder that affects about 20% of the population, especially from the age of 40-50, both in women and men. As age advances, the risk of developing this disorder increases, affecting around 70% of people over 70. This medical condition is known as nocturia and is characterized by the urgent need to urinate during the night, often more than once, causing repeated awakenings. Those who suffer from it are therefore forced to get out of bed, interrupting their sleep, with possible consequences on their health and quality of life. The aging process, behavioral habits, and a multitude of pathological conditions are the main factors that contribute to the development of nocturia, but we will talk about this in more detail in a future video. In this one, we will see what are the most effective remedies to keep this disorder under control and improve its symptoms. 1. Although it may seem like obvious advice, reducing fluid intake before bed is the first step to combat nocturia. When we drink, the fluids pass through the digestive tract, are filtered by the kidneys, and then gradually begin to accumulate in the bladder. Since this process takes time, however, we may not feel any urge to go to bed, but as the kidneys filter the fluids we have consumed, the bladder will begin to fill. Once a certain threshold is reached, we will feel the urge to urinate, which will interrupt our sleep, forcing us to get up. For this reason, experts recommend limiting the intake of liquids, such as water, tea, and herbal teas, in the 2 hours before going to bed, so as to avoid excessive filling of the bladder during the night. However, it is essential that this habit does not decrease the daily water requirement, which we remember is extremely important for the correct functioning of the entire organism. 2. There are some foods and drinks that can irritate the bladder and increase the frequency of urinary urges, worsening nocturia. This is because some substances, such as caffeine, increase the contractility of the smooth muscles of the lower urinary tract and stimulate the central nervous system, helping to increase diuresis. Alcohol can also irritate the bladder mucosa, causing a series of involuntary contractions, even when the bladder is not completely full. Furthermore, caffeine and alcohol are diuretics, that is, they are able to stimulate urination and therefore increase urinary frequency. This is because both substances reduce the secretion of vasopressin, a hormone produced by the hypothalamus, responsible for maintaining the body's water balance. Also be careful with the consumption of acidic or spicy foods, such as citrus fruits, tomatoes, and chocolate, but also chili pepper and other stronger spices, such as pepper and curry. These foods can irritate the bladder and increase the urinary urge, contributing to nocturia. For this reason, experts recommend limiting their consumption, especially in the evening hours. 3. Taking certain medications can increase urine production and therefore affect the frequency of urination, worsening nocturia. Some of these are diuretics, which promote the elimination of fluids from the body, and antihypertensives, which act on the circulatory system, but also some antidepressants and anxiolytics, and drugs for diabetes. For this reason, it is possible to evaluate the possibility of changing the times of intake of these drugs, moving them to the morning or early afternoon hours. This is a decision that must be made exclusively by your doctor, who, based on your health condition, will be able to suggest the most suitable solution, without compromising the effectiveness of the current therapy. 4. Graduated compression stockings are elastic stockings that apply controlled pressure on the legs to promote venous and lymphatic return in the lower limbs, alleviating the feeling of heaviness and swelling. They are divided into 4 compression classes, depending on the pressure they exert on the ankle, and are generally used to treat or prevent various conditions related to blood circulation, such as varicose veins, venous insufficiency, and deep vein thrombosis. Graduated compression stockings have also been used as a treatment for nocturia in recent years. A study conducted by Japanese researchers on 31 patients suffering from nocturia suggested that the use of compression stockings during the day was satisfactory in most patients. The results showed a decrease in the frequency of urination at night and over the course of 24 hours, as well as an increase in the hours of undisturbed sleep. Compression stockings could therefore improve nocturia, as they promote venous return and reduce the accumulation of fluids in the legs during the day. In this way, the release of these liquids during the night is limited, reducing urine production and consequently the need to get up. Another good strategy to promote venous return is to elevate your legs and feet before going to sleep, positioning them slightly above the level of your heart. 5. Kegel exercises, named after the American gynecologist who invented them, are repeated voluntary contractions of the pelvic floor muscles, followed by a relaxation phase, interspersed with pauses. These exercises are designed to tone and strengthen the muscles that support the bladder, the rectum, and in women, the uterus. They are used to solve some problems, for example to improve urinary or fecal incontinence, as well as to treat some sexual dysfunctions and chronic constipation. Kegel exercises also help to strengthen the muscles that control urination, reducing the need to go to the bathroom during the night. However, their effectiveness depends on the underlying cause of nocturia, so they can only be helpful in cases of pelvic floor weakness or reduced muscle control of the urinary sphincters. However, these are exercises that must always be done under medical supervision to ensure correct execution and maximize results, as well as to avoid worsening symptoms. If not performed correctly, or if you overdo the training, you could get the opposite effect, that is, weaken the pelvic floor and increase the risk of urinary tract infections. In conclusion, we have seen how nocturia is a fairly common disorder in the general population, but it is possible to keep it under control with some simple changes in lifestyle. However, they are not always sufficient to completely eliminate the problem, since in many cases, nocturia can be caused by some pathologies. Among these, we find some bladder dysfunctions, benign prostatic hypertrophy, and interstitial cystitis, but also neurological pathologies that affect bladder control, such as multiple sclerosis and Parkinson's disease. In this case, it is best to contact your doctor or a specialist for an in-depth evaluation and to identify the most appropriate treatment, including the administration of pharmacological therapy.